Hello, PsychU community, and welcome to today's webinar, where we will provide perspectives on suicide and Black Americans around statistics, faith, and contextual competence. My name is Dr. Amika Simmons-Yan, and I am from Otska Neuroscience Medical Affairs, and I will serve as the moderator for this timely and much-needed discussion. Now, as you may know, September is National Suicide Prevention Month. So we are so encouraged that you have joined the awareness efforts, and we look forward to learning as a community. Given this important awareness month, it would be amiss if I did not provide the suicide prevention hotline. So to all of you out there, if you or someone you know is in crises, please call the Lifeline at 1-800-273-TALK, or even text the crisis line at 741-741. Please keep this information handy and be the one to share it. This webinar is sponsored by Otska and Lumbeck. I think a great place to start is with awareness and the data. So, Dr. Singer, when it comes to mental health and suicide, what are the statistics? And is it a myth that suicide is not a significant concern in the Black community?
Yeah, thank you so much. I think that one of the important things about statistics, particularly when it comes to the issue of suicide, is that we always have to assume that there's a certain amount of underreporting going on with suicide data. And so we're presenting these numbers that are from the Centers for Disease Control, looking at suicide by race. And I just want to acknowledge that the federal government collects data on these four different racial groups, and then there's this Hispanic category, which is considered an ethnicity. And so you can have persons of Hispanic origin, maybe of any race. All other racial or ethnic groups are non-Hispanic. So I just want to be clear that that's what we're talking about here. If we look at the group with the highest rates of suicide per 100,000 in 2019, which, by the way, is the most recent year that we have final data for. We have some preliminary data for 2020, but we don't have final data. We can see that both for females and males, the highest rate is among American Indian folks. And then we see that it's white folks, but then, we see that it's Black Americans and then Hispanic as a group, and then Asian Pacific Islander. So this idea that suicide is only a white person problem, or it's not something that is a significant concern in other racial or ethnic groups, isn't borne out by the data. And again, as I said, we have to assume that there is some underreporting. And this is an important piece to consider when we think about the discrimination that comes along with the identification of someone's death as a suicide, the shame, different community contexts associated with that. And that can be in any racial or ethnic group, in any community, there can be that. But knowing that it's there and understanding how it happens, or that it happens, I think is really important.
Thank you for that. And as you have gone through the data, we just know that suicide is a significant public health concern, and you hit on quite a bit of great points that we'll discuss further in this webinar. But Dr. Molock, if you don't mind, I want to pass the discussion to you. We've had past discussions, and I have expressed that there are providers who are seeking data on suicide in the Black community. So do you think the suicide death rates, as they are reported now, are a good representation of what's going on for Black Americans? And if not, how can we do a better job at monitoring and collecting data, doing the research and funding?
Before I answer that, let me say thank you for having me here, and it's an honor to be here with Dr. Singer, and he and I are old friends and colleagues, and we've talked about this quite a bit actually, this question. I think one of the issues that comes up is when you look at surveillance data and acknowledging that there are groups that are inherently underrepresented. And he brought up one of those groups, people who live in rural communities. So if we know that those people are harder to get to count, and we also know that the data that's collected, while people make valiant efforts, the data is not perfect, then we also know that underserved communities tend to be undercounted, period. Regardless of why you're underserved. It could be young people, it could be because you live in a rural community, it could be because you're in a stigmatized group where people are less likely to report suicides. So we know from the data that Black people are more likely to be misclassified, for example. Why? One reason for that is that if you have an ambiguous death, and let's say you live in a small community, and the community, you know the coroner, and I don't know if people know this, anybody can be a coroner in some communities. That varies community by community. So I could be a coroner and I don't have any background training for that. Other more urban areas tend to have medical examiners, people who've gone to med school. So if you're in a small community and your local barber is also the coroner, and there's a lot of stigma associated with suicide, and let's say it's an enclave of Black folks who live there, then they might decide to classify a death that's questionable as an accident or even natural causes. I've seen that because they realize of the stigma that will be associated with the family, and they don't want to put the family through that. Well, that's understandable. What happens is we don't have accurate data on actually what happened. The other reason why Blacks might be more likely to be misclassified is they're more likely to have unusual causes of death that make it difficult to classify. And examples of that would be drowning. It's really hard to classify drowning as a suicide unless you've left a note or left some obvious signs at the scene. If people, for example, die in their car and their car is immersed in a lake, is that an accident or was that something that was done intentionally? Believe it or not, vehicular accidents is the same thing. Sometimes it's clear at the scene what the cause of death is, whether it's a suicide or an accident, but sometimes it's not. And so stabbings, getting hit by a vehicle, jumping or falling from a building, African Americans are more likely to die from those types of deaths. And even though they are a small percentage of suicides, they're still, they're significant enough where there might be a misclassification. So I think that's one thing. One thing is, I hate to say this, but I think because both Black and white people think that Black people don't complete suicide is a problem, because then when the death is questionable, it doesn't occur to you that this could be a suicide. And people will say things like they didn't leave a note. Most people who complete suicide don't leave a note. So that cannot be the defining criteria that you use for whether or not you classify someone as having a suicide death.